On the cool mornings of summer, I like to start my day walking my dogs. But I always get nervous when one starts scratching the minute we get home. My little Japanese chin has allergies. His frequent scratching sometimes leads to a skin infection and the need for antibiotics. My veterinarian is cautious about using antibiotics because she worries about antibiotic resistance. That's what happens when you get infected by a bacteria that most antibiotics can't cure. I've had one of those, and it wasn't fun. Hi, I'm Lori Johns. Today on ChopTalk, we're talking about antibiotics and how they're used today on the farm. How we all use antibiotics matters because the Centers for Disease Control says more than 2.8 million antibiotic-resistant infections occur in the U.S. each year. We're all using too many of them and not using them correctly. It's what's prompted the rule changes in pig farming in 2017 when the FDA instituted the Veterinary Feed Directive. Today, livestock farmers can only get antibiotics through their veterinarian, who must certify that they're medically necessary. The change is good news for pigs, pets, and people who love pork. When it comes to antibiotics, there's a lot to take in. So let's begin with Dr. Heather Fowler, a veterinarian who also has a PhD in human health and safety and a master's in public health.
So my title at the National Pork Board is Director of Producer and Public Health. I oversee our research programs as it relates to worker safety for our farmers on the farm, as well as public health. So to just topics that might potentially impact public health. So I oversee that research. I develop content. So if I need to share it out with farmers, with consumers, various audiences. And I also do education and outreach, like I'm here today sharing that story.
Well, and it's a good story to share because a lot of people do have questions. And there is misinformation out there, certainly. But where do we get started? What is the main thing for people listening right now that you want them to know about how pigs are raised and how that might impact consumers?
The main message here is that America's pig farmers are committed to doing what's right for people, pigs, and planet. For folks out there that are familiar with the One Health concept, that's the concept that says human health, animal health, and environmental health are all connected, and you need to take a holistic approach to those types of issues or issues where human, animals, and environment come together. And that's on our pig farm.
I love that idea, and it is so important because you think of that whole circle of life, that cycle of sustainability. Iowa pig farmers are very much into that because they need to be. And it's such an important question, especially when it comes to the use of antibiotics and what that might mean for us. You know, people have questions like antibiotics. How do they know when pig farmers use it? And is it the same type of antibiotics that, you know, they were giving people in the 80s, tetracycline for acne or something? I mean, what's going on? Where do we begin with this information?
I think we need to begin with that commitment again. Know that America's pig farmers are committed to doing what's right for people, pigs, and planet. And that crosses all the different activities that they're carrying out on the farms. So our pig farmers are in charge of protecting and promoting the health of these animals. And just like you can get sick, sometimes the pigs get sick. So they need to work with their veterinarians to make sure that they're protecting and promoting health on the farm. And that might at times include using antibiotics. But for consumers listening today, I want them to know that, one, I mentioned already, they're working with their veterinarians. They're writing this down. They're making sure that it's not going to be a food safety issue. So they're following the rules and regulations around use to make sure it doesn't cause any issues at the meat case.
But when it comes to buying that pork chop in the grocery store, we want folks to know there are no antibiotics in the meat.
Absolutely. And again, there are organizations and agencies that regulate that. Our farmers are recording their use on the farm. They know when they start and they stop and are making sure that there are no residues are present in the product.
Yeah, because you want a healthy animal before it goes to market. So it's just a healthy, well animal. And so that's the bottom line. And that's what people expect from each other, too, right? We have to be responsible about the antibiotics we use, too, or that we give our kids.
Exactly. We know that use in some ways can drive resistance. So seeing it being used in human health and veterinary medicine, we need to make sure that it's absolutely imperative or absolutely needed at that time, and then work to reduce the overall need for antibiotics in any given case.
Because I found it so interesting when there was, I remember reading Oh, it was from a reporter talking about antibiotic resistance and, not a big fan of current of pig farming, whatever reasons. And it started because she went to her dermatologist and wanted tetracycline for acne. And I'm like, now, just think about that for just a second. You're asking for an antibiotic for zits, and you're worried that pig farmers aren't being responsible about antibiotics. There's a lot of head-scratching moments I think you must come across, too, all the time.
Yeah, and my human health colleagues are dealing with the pressures. Their patients can talk and ask for specific things. Right. And I think it's just common culture to say, I'm sick, give me something to make me feel better. Folks don't always feel comfortable with sleep it off, hydrate, rest, right? Give me something that will fix it. And I think when we engage in this conversation around antibiotic use on the farm, they're working with their veterinarians on herd health plans, whether that's vaccination, how to move animals into and out of the facility, cleaning the facility. There's all these different things that we do before we even reach for an antibiotic. So I think communicating that to the consumer and understanding that when we grab for those antibiotics, it's because we need them. And our veterinarians, again, are involved in that process. They are sending in samples, they're seeing the animals and diagnosing the condition and knowing, given their knowledge of veterinary medicine and antibiotics, they're identifying what the bug is that needs to be treated and what that drug is that is effective for it. And then they're following up. So it's not just grabbing it out of the cabinet because it's Tuesday, right? Right? This is based on science. It's based on other actions that we've taken to reduce the overall need for those antibiotics. So just driving that home that this is not just a willy-nilly decision. There's so much science in interaction and communication and relationship with the farmers and the veterinarians that goes into that. So again, our producers are committed to doing what's right for people, pigs, and planet. And that means using antibiotics appropriately, minimizing that overall need for antibiotics, and involving the veterinarians in that process to hopefully curb the trend of antimicrobial resistance.
The key here involves veterinarians. Iowa pig farmers turn to their veterinarian to find out if their animals even need medicine, and if so, what kind. While there aren't new antibiotics being developed right now, there are other innovations in animal science that might one day reduce or even eliminate the need to use them. To learn more, I went to Iowa State University, which leads the nation in animal science, where they're training the next generation of veterinarians. I'm here with Dr. Locke Karriker with Iowa State Veterinary Medicine, swine medicine in particular here at Iowa State that you specialize in. Welcome, doctor. Nice to meet you.
Yes, thanks for having me.
Tell me about what you do here at Iowa State to train the next generation of veterinary medicine leaders.
Yeah, so actually we have the only center in North America, probably the only center in the world that's dedicated to educating swine veterinarians specifically. So the Swine Medicine Education Center, which I'm the director of. And so we're actually involved in education at a number of different levels. We have teaching obligations with other veterinary colleges. So we'll actually go in and teach the swine core component of their particular curriculum. We focus obviously on our own students. We teach in undergraduate courses. We also teach primarily in the fourth year of the veterinary curriculum in clinical rotation. So we'll actually take students out to farms. We'll solve client problems and look at health issues and try to help build their skill set. And then we collaborate with other groups in Iowa, like Northern Iowa Community College and their vet technician program. And so we'll bring those students in and get them exposed to swine medicine as well.
So what are their primary questions, or what's the focus that they work on in those early years? What do they want to know?
So a lot of our focus is on how do you take information from a lot of different sources and try to pull that together and understand what's going on with the animals, and also understand then how you might better diagnose their particular condition and what treatments might be necessary. And because most of the time we're working with pigs that are in large groups, a big part of what we train is how do you find the one pig that best represents the disease problem or best represents the health challenge that would provide you with the most information about the case.
Because I know there are challenges that evolve year to year, month to month. It seems like there's always something to study and to learn, or something that's coming over from another country to also take a look at.
Yeah, absolutely. And it's really impossible for us to future-proof our students in the sense that they're going to see everything they might encounter as a practitioner. And so it's really about what's the thought process? How do I assess information that comes in? How do I evaluate the pigs themselves? And then tie those two things together to reach the right point in terms of treatment or diagnosis. So it's incorporating that factual knowledge and then understanding that over time, all those facts are going to change or be expanded or new ones will arrive.
Well, speaking of new ones and new approaches, you've probably seen a lot evolve in your career, even just from when you started out to where things are now. And I'm thinking of antibiotics in particular. People who don't come from a farm, but they do enjoy a good cut of pork. They might have questions about how did that animal live its life and stay healthy. And then there's the other side out there. Well, oh my gosh, antibiotics. What is actually happening? How have things evolved for the better?
So there's been a series of changes in how antimicrobials and other drugs are regulated. And so veterinarians are responsible then for following those rules. So the first change was the end of the use of antimicrobials purely for growth promotion. So they're not available any longer to use on healthy animals just to make them grow faster. The next change was we took all of the drugs that were provided in the feed and we made them subject to a prescription type component called a veterinary feed directive. And so a veterinarian has to sign off on the use of that antimicrobial in the feed before it's used. And that means that they have to also have some documentation about what the need is and the disease purpose. The next thing that changed was all other antimicrobials, some of which used to be available over the counter at feed stores and co-ops and things, are no longer available over the counter. They have to have a prescription. So anything in the water and just about anything that's injected now requires a prescription. And so those steps now have taken antimicrobials, especially that were available through a wide range of sources, and really put them under the supervision of veterinarians. So I think that veterinarians are trained to understand the most judicious ways to use them and the ways that are going to be the safest for the product and the best for the outcome of the pig. And so I think that's a big step forward.
And that's important for consumers to understand because they may not know that.
We have a very, very safe pork supply, and we also have a number of tools necessary to ensure animal health and welfare. And that's an important balance to keep. So when you think about animal health and welfare, you really can't provide that completely unless you're using all the tools that are available. And some of those tools are antibiotics. And when we use antibiotics and we treat animals and we clear disease from those animals, then we create a safer product for consumers. The question then becomes, the fate of the antibiotics themselves. And what's probably more advanced here in the U.S. than a lot of places is we have a rigorous testing program. The federal government tests the meat. They do the science to establish what level, if any, of the antibiotic is safe. Most of our drugs have no tolerance, so the animal has to be free by the time they're marketed. Some of our drugs do, and a lot of those are actually drugs that humans are normally using and are given, and so we already know what the safety levels of those are. It's a balance that we work to maintain, and I think the concern from consumers is, are we overusing those antibiotics? Are we using them in an environment that increases resistance? And so those are questions and concerns that we share, because long before resistance reaches the human population, it's resistance within the pig population, and that means our treatment of the animals starts to fail. So we have somewhat of an early warning system in that respect, that if we can make sure we're using antibiotics in a way that they stay effective in the pigs, we're less likely to be creating resistance that will escape and ultimately create a problem for people. Other elements of veterinary medicine, companion animal medicine, for example, they're not subject to quite the same rules and regulations, but food animals have a significant amount of regulation that we have to follow and have to pay attention to.
I didn't know that, especially when I think of my little dog with his skin allergies and the infection. So different protocols for whatever the vet's specializing in, because animal care, swine vets in particular, for just letting people know that.
Yeah, absolutely. In fact, a lot of times when I take my own dog to a vet, because I've focused on swine so long, long, but when I do that, I'm sort of amazed at the options that they have available. And I'll look at some of those and I'm like, wow, that would be fantastic to be able to use that drug, but it's not allowed. My range of options in pigs is much narrower and they're much more specific. So we don't have that latitude. So we have to prevent disease. And then when that fails, we have to make sure that we're using the drugs we have, very judiciously, because when they stop working, there's nothing else. So we've got to protect them.
Well, so it all starts with environment. It starts with good management, right? And even learning about typical pig behavior, because a pig is not a dog. It doesn't react the same way. It's not going to be the same thing. I have a dog that's got so many allergies. He's on an antibiotic right now. And I think about that, and now he's better. And that's the way it works. And so if an animal, no matter what it is, if it's not feeling well, it deserves to be treated. But it does begin with management. It begins with the environment. And that's changed a lot in your time too.
It's changed dramatically. I mean, we have adopted filtering technology. So we actually filter the air that goes into the farms in an effort to try to prevent the entry of various disease conditions. We've got a better understanding of water sources and what the risks are associated there. We're actually working on some research now here at the Swine Medicine Education Center along those lines to understand what biosecurity and water treatment things add additional protection. We've learned a lot about animal behavior in terms of not only how they can earlier provide signals of disease, so you can treat earlier with less antimicrobial and have more effective outcomes, but also understanding how they're demonstrating the appropriateness of the environment, right? And so understanding how pig behavior guides you and providing the right environment for them is a really important component. And as a lot of recent research, it wasn't available. I think the important things are just to remember that there is a strong effort and motivation to use fewer antibiotics, and the industry has voluntarily taken steps to remove them for growth promotion and things like that. So we use them when they're needed. We're working on skill sets to better identify individual animals in groups, so we treat individuals more and groups less. And our meat supply is tested. It's tested and it's observed, and there are big repercussions if they happen to find antimicrobials or other drugs. And so I think there's a lot of reasons to have confidence about that.
So, talking to experts in animal health and those who train veterinarians on the latest information does instill confidence. So does getting on the farm, talking to a farmer to see how these changes are put into place. For that, we turn to Iowa farmer Mike Paustian, a sixth-generation Iowa farmer who also happens to have a PhD in microbiology. Does Dr. Mike, the microbiologist, do you have to work with a veterinarian too?
Yes, even me. We have a great relationship with Dr. Allison, our veterinarian. He's out at our farm on a regular basis, sees our pigs, is in our barns, knows kind of what health challenges we've had in the past and what we can kind of expect to see. And he's always a phone call away for seeing stuff. And the way things are now, I can even take a picture of a sick pig and text it to him and say, hey, look at this. What do you think? Kind of thing. So yeah, that's critically important because our veterinarians are the ones who are, they're living and breathing this every day with animal health, and they can help determine what's the most appropriate intervention. And in some cases that might be an antibiotic. In some cases it might be something else, just like aspirin or something like that.
Right.
And so we want to make sure that we're being very judicial with our use of antibiotics, because it's just a waste to use it for using an animal that's not that sick, or if a pig has a virus, that virus is not going to be affected at all by that antibiotic.
Right.
So it's not an appropriate use. That's why I've heard parents sometimes be frustrated that they take their kid to the doctor for an ear infection and they won't prescribe an antibiotic. Well, that's because it's a virus, and that the doctor knows that an antibiotic isn't going to be helpful in that situation.
They don't get the pink stuff?
No, there's no pink stuff for pigs, unfortunately. If you think it's hard talking a kid into drinking a weird tasting antibiotic, just think about what it would take to get a pig to do that, right?
Well, and when it comes to those rules, by the way, too. So there isn't, even if a pig needs it, let's say they need that because it's been tested and they know it's not viral and they're not going to get better on their own, so they need the medication. There are hard and fast rules over when the medication has to stop long before this pig goes to the market. How does that work?
Yes, for sure. Yeah, they're very, very strict, what they call withdrawal times. And so that's the experts, the veterinarians, scientists, every antibiotic that's used in animals has been thoroughly studied to where they know exactly how long, once that antibiotic goes into that animal, they know exactly how long it takes for that antibiotic to be broken down and basically flushed out of the body. And so by the time that animal goes to market, that antibiotic is long gone. And I think people get confused sometimes because you can go to the grocery store and you can buy antibiotic-free this, that, or the other thing, right? And in many cases, that's an animal that's been raised, without any antibiotics ever, which can be done if that animal is fortunate enough to never have been sick, over its lifespan. But people need to understand that all the meat they buy at the store is antibiotic free.
By law.
Yes. And we get our animals, when they go to slaughter, they are tested all the time to verify that there are no antibiotics present. And so we have to keep very, very detailed records on when we give an animal an antibiotic, where that animal was, what the date was, and all of that. And those records get audited so that people know.
Well, that's how far pig farming has come. The innovations, the rules, all this and that wasn't around 100 years ago. So when people are hearkening to the good old days and stuff, they probably don't realize how much these changes have really benefited everybody.
Yes, definitely. And, and as producers, we hear loud and clear from consumers who are concerned about antibiotic use. They're concerned that they want antibiotics to still be effective for humans to use when they need them. We're hearing those concerns. And so, we're constantly striving to use as little antibiotics as possible, and there's a lot of work's been done in the last 5 to 10 years on looking at, alternatives like probiotics. I think a lot of people have heard about that. You buy the special yogurt and that's
for people. Yeah.
Right. It's gonna feed the good bugs and help. And I kind of alluded to that earlier, but that there is a lot of value to looking at that area where, if we can do things to prevent pigs from getting sick in the first place, that's the best way to lower antibiotic usage. So the big things there are, there's some nutritional things, some probiotics, things like that, but also it just comes down to biosecurity. And biosecurity means that we're just being very careful when we go into our barns. We're putting boots on when we go to our barns. Sometimes we're using coveralls. Some barns we're taking showers to go into. All of those things are designed to make sure we aren't bringing any kind of germ with us and spreading it around to pigs. So the more we can do that to even keep them from getting sick in the first place, that's going to go a long ways to helping us minimize our need for antibiotics.
Keeping those barns pristine and protected, keeping the pigs protected.
Yep.
And people don't realize how important that is.
Yeah, it's critical. I mean, we spend hours and hours and hours just washing out barns, disinfecting them in between groups because you don't want to bring a bunch of little pigs into a barn that just had big pigs in it because those big pigs maybe had some germs that those little pigs haven't been exposed to. So we literally clean those barns out good enough that you could eat off the floor, no problem. Wow. I mean, they're cleaner than the floor in my house, I guarantee. and we disinfect them and make sure, because we don't want anything in there that could make those little pigs sick when they first come in. So, things like that. Sadly, it's made us a little antisocial amongst other pork producers. I don't go visit other pig farms and they don't come visit me unless we've been away from pigs for several days because we don't want to spread germs between our own farms because, different farms could have different bacteria or viruses on them. As far as looking towards the future, there's been a lot of work done with genetics to try to help make animals that are breed animals that are more resistant to disease. And that has a lot of potential as well for helping to reduce our need to use antibiotics. Because if we can just, make those animals a little hardier so they're able to fight off different bacteria and viruses on their own, then we might not need to intervene with something like an antibiotic.
Well, we see that in the plant world as well. Roses that are bred to be resistant to black spot, different funguses, that sort of thing. So it follows its biology, right, to make animals less susceptible to things.
Yep. Yeah, there's just all these different pieces in the puzzle that we try to put together to get a complete picture of animal health.
So the bottom line, if you have questions about whether that antibiotic is really necessary for you or your family, ask your doctor if this infection is caused by a bacteria or could this be a virus. Antibiotics won't help cure a virus. Same goes if you find your pet needing medicine. Ask your vet. And rest easy that no antibiotic-resistant case has been medically linked to eating pork. It just doesn't work that way. There are no antibiotics in pork, no matter how it's raised, because meat in this country is inspected for any kind of residue. And even if pigs do need antibiotics, they're taken off them long before they go to market, because it's the law. I'm Lori Johns. Thanks for joining me. Now, on our next Chop Talk, how do Iowa pig farmers embrace transparency and communication to responsibly grow their farms while keeping the neighbors happy? It's a beautiful day in the neighborhood on the next Chop Talk.